Hello all. Today we are going to learn about tetralogy of fallot. Tetralogy of fallot is a congenital heart disease seen in the children. So as the name indicates, there are four problems in the heart. Today we will try to understand what are those four conditions which are causing tetralogy of fallot in children. So here is our heart model again. What usually happens is that the circulation in the heart will be as follows. Through inferior vena cava and superior vena cava, the deoxygenated blood from the entire body is collected in the right side of the heart. Then this deoxygenated blood will go to the lungs through pulmonary artery. It will go to lungs for oxygenation through pulmonary artery. The oxygenated blood from the lungs will enter the left side of the heart through pulmonary veins. So the heart, right side of the heart will be deoxygenated blood, left side of the heart will be oxygenated blood. This is usually the circulation of in the heart. But in the tetralogy of fallot, what happens is that the cornal septum or interventricular septum which is present here is malaligned or not developed properly during the embryonic development. This septum will be pushed right side and more anteriorly. See how this septum is pushed. This interventricular septum is pushed right side and more anteriorly. So what does it, this push is leading to stenosis of this pulmonary artery. So that is the first defect in the tetralogy of fallot to be discussed, pulmonary artery stenosis. So this is caused because of this cornal septum to be displaced more anteriorly towards the right ventricle. So because of this displacement, there is a stenosis in the pulmonary artery. So that is the first defect in the tetralogy of fallot, that is pulmonary stenosis. When there is pulmonary stenosis, the blood which is present in the right ventricle will be very difficult to move into the lungs because there is stenosis. It is very narrow area to get the blood transported to the lungs. So in order to push the blood through this narrow area, the right ventricle has to really put lot of efforts to push this blood into the lungs. So then what happens when there is lot of pressure, when there is lot of effort that is put by the right ventricle to push the deoxygenated blood through this stenosed or obstructed pulmonary artery, this will undergo, as a compensation, this will undergo hypertrophy. So this is known as right ventricular hypertrophy. See, you can see there is hypertrophy of the right ventricle. There is hypertrophy of the right ventricle because there is lot of efforts that has to be put by the right ventricle to push the blood into the lungs through this stenosed pulmonary artery. So in order to compensate that contraction and heavy efforts, the right ventricle will become thickened or hypertrophized. So this is the second point in tetralogy of fallot, that is right ventricular hypertrophy. So we have understood why there is pulmonary stenosis, the first defect in the tetralogy of fallot, and the second defect is right ventricular hypertrophy. So we have understood two. Then next one is that because of this malalignment of interventricular septum, there is a gap that is formed in between the interventricular septum. When there is an opening which is present like this, right, there is no continuity of interventricular septum. There is disjunction of interventricular septum. Because of this disjunction of interventricular septum, there is a chance of shunting of blood from left to right or right to left. So shunting of blood means the reverse flow of blood or altered flow of blood is the right word to say. Altered flow of blood because of the disjunction of interventricular septum is known as ventricular septal defect. So this is what is ventricular septal defect. Under a few conditions, when the pressures are normal in the right ventricle, there will be flow of this oxygenated blood into deoxygenated blood. This blood will get mixed up. Usually what should happen? The oxygenated blood should go through aorta and should reach entire body. But this is not happening here. What is happening? Because of this disjunction, this oxygenated blood is again getting mixed up with this deoxygenated blood through this septal defect. Through this septal defect, it is getting mixed up with deoxygenated blood. So this is actually not a problem for till some stage, because what happens is that this oxygenated blood is coming and mixing with deoxygenated blood. And what will happen? This deoxygenated blood will again enter into the lungs and get oxygenated, and again it will fill the left side of the heart. So until there is, increased pressures created in the right ventricle, and there is lot of blood which is coming from left side to right side, and at that stage what happens? When there is increased amount of blood flow from the right side of the heart to the left side, and there is lot of amount of blood that is going into the lungs because of this ventricular septal defect, it will cause congestive heart failure. So initially, till the pressures are normal, the baby will look pink, because again the blood is getting oxygenated and reaching the right ventricle, so that should not be a problem. But when the pressures in the right ventricle are increased because of the increased flow of blood from the left ventricle, this will cause increased blood flow to the lungs. That high flow of blood into the lungs will cause congestive heart failure. So this is one type of shunt from left to right. What happens if right side blood get mixed into left side? When there is excessive pressure build up in the right ventricle. So there is lot of blood that is filled up in the right ventricle. Because of this pulmonary artery stenosis, this blood can't escape in this way, because this is getting narrower day by day. This is getting narrower. So where is the other passage? Again this septal defect. So now the blood will go and mix. This deoxygenated blood, dangerous deoxygenated blood, is mixing with the oxygenated blood. See? Like this, the deoxygenated blood is mixing with the oxygenated blood. Now what will happen? Through aorta, this deoxygenated blood is supplied to the body. So this will cause hypoxia. There is lack of oxygen in the circulation, because this deoxygenated blood is getting into aorta and going to the body's circulation. So that will cause a severe problem, severe hypoxic conditions, and baby will become blue. That is cyanotic. Baby will become more cyanotic. So right to left shunt is very dangerous, and the baby will immediately become cyanotic. So that is all about the ventricular septal defect. I think you have got what is ventricular septal defect now. So we have discussed 3 points. What are those 3 points? There is pulmonary artery stenosis because of the conal or interseptal displacement towards this side, which is narrowing towards right ventricle, which is narrowing the pulmonary artery because of the septum that is pushed this side, narrowing this pulmonary artery. So, and then what happens? In order to push the blood against this narrow artery, the right ventricle have to keep lot of efforts. In order to compensate that great efforts to push the blood through this stenosed artery, this will become hypertrophized. So pulmonary stenosis, right ventricular hypertrophy, we've seen, and ventricular septal defect with right to left and left to right shunt and their consequences we have seen. The last point in tetralogy of fallot is aorta displacement. As I have said that the septum, the interventricular septum is deviating this side, the aorta actually should be in connection with only the left ventricle so that it carries only the oxygenated blood to the entire body. But what happens in tetralogy of fallot is that the aorta will be displaced and gets communication with both deoxygenated right ventricle and oxygenated left ventricle. So the aorta is getting into the communication with both right and left ventricles. So there is the deoxygenated and oxygenated blood getting into the body circulation. So that is the disruption of normal blood flow to the body. So these are the 4 defects in tetralogy of fallot: pulmonary artery stenosis, right ventricular hypertrophy, ventricular septal defect, and aortic displacement. So these are the 4 problems in the tetralogy of fallot. In this tetralogy of fallot, children will be having a sudden or acute hypoxic attacks. The condition of acute hypoxic attacks is known as TET spells. So TET spells is a medical emergency wherein the patient is under physical exertion. When a child is having a good type of physical activity, he will suddenly have an breathlessness and may go into unconsciousness because of the deoxygenated blood that is coming into the circulation. And finally, they may go into the brain damage due to this severe hypoxic attack. So this is considered as a medical emergency that can be corrected by using some techniques like squats, which will actually decrease the deoxygenation in the body. So the diagnosis of tetralogy of fallot can be done by echocardiography during the prenatal life. When the mother is pregnant, we can rule out the tetralogy of fallot by echocardiography. And the treatment will be concentrated on the correction of ventricular septal defect and enlargement of the aortic stenosis. So this is all about tetralogy of fallot. I hope you have understood. Thank you for watching our videos at Inward, and stay tuned. Thank you so much.